hello, and welcome back to the channel. It's Dr. Nell in your community safe space where meaningful conversations take place. Today, we're having a conversation about my favorite group of people, the aging and the elderly. We're not going to delay, we're going to jump right into it, and I hope you're having a wonderful day. It's a little overcast today, but we're outside. We're going to take a walk and we're going to have that meaningful conversation. So let's get ready. Are you ready? Let's go. Imagine needing to see your doctor, but the clinic is 20 miles away. You no longer drive. The bus only runs, say, once every 2 hours. Your family lives in another state or way across town. So you cancel the appointment. For millions of older adults, this is not a rare situation. It is their reality. Transportation barriers are one of the most overlooked causes of healthcare inequity for elderly populations. When transportation issues intersect with ageism, the result can be delayed care, worsening chronic disease, and preventable hospitalizations. Today, we are discussing how transportation barriers impact healthcare access for older adults, how ageism contributes to healthcare inequality, why this issue is becoming more common, and what communities and healthcare systems can do to improve access. Because healthcare access should not and never depend on whether someone can find a ride. Now, we're going to go back to a topic that we discussed in a previous video, and that is transport as a social determinant of health. Transportation is considered a social determinant of health. This means it directly affects a person's ability to access healthcare services. As individuals age, many experience vision decline, slower reaction time, chronic illness, mobility limitations, and medication side effects, just to name a few of these conditions. These challenges can make driving unsafe or impossible. Yet, many healthcare systems still assume patients can easily travel to their appointments. Can you hear the bird? Can you see the bird? When older adults lose their ability to drive, their healthcare access can become severely limited. Missed transportation can mean missing routine checkups, specialist appointments, physical therapy, dialysis treatments, and prescription refills. Over time, missing care can turn manageable health conditions into serious medical complications. Transportation barriers affect many groups, but older adults are especially vulnerable. This issue is particularly severe for seniors who live in rural communities, who live alone, rely on fixed incomes, manage multiple chronic illness, or have limited public transportation access. In many areas, the closest hospital or specialty clinic may be 30 to 50 miles away, or it could be 30 to 50 minutes. Either can become difficult for the elderly. For someone without reliable transportation, that distance might as well be hundreds of miles away. When transportation becomes a barrier, healthcare access becomes unequal. Instead of receiving preventative care, many seniors end up relying on emergency rooms when conditions worsen. Now, we want to consider the role of ageism in healthcare access. Transportation barriers alone are challenging, but add ageism and it intensifies the problem. Ageism refers to stereotypes, discrimination, or systemic neglect directed toward people because of their age. In healthcare systems, ageism can appear in subtle ways, such as assuming older adults are less independent, dismissing symptoms as just aging, or designing services without considering elderly mobility challenges. Healthcare facilities may offer services designed for working adults, such as extended evening hours, but transportation solutions for seniors are often missing. Providers may schedule multiple follow-up visits without asking a critical question, and the question is, do you have reliable transportation to get there? That is a question that many are struggling with and providers avoid to answer. When transportation barriers are ignored, it reveals a deeper issue. Healthcare systems sometimes fail to fully prioritize the needs of our older adults. Now, when that is done, there becomes a consequence. Now, let's look at the healthcare consequences. Transportation barriers do more than cause inconvenience. They lead to real and measurable health consequences. Older adults who struggle to reach healthcare services may experience delayed diagnosis, worsening chronic conditions, medication interruptions, increased risk of hospitalization, or preventable complications. For conditions like heart disease, diabetes, and hypertension, consistent medical care is essential. Without reliable transportation, prevention becomes difficult and healthcare becomes reactive instead of proactive. Now, there are possible solutions. Addressing transportation barriers requires both community action and healthcare system change. Some potential solutions include medical transportation programs, community transportation services designed specifically for healthcare visits, or healthcare provided ride programs. Some hospitals and clinics partner with transportation services to assist their patients to limit the risk or make things easier for them to get to their appointments. There's also the need, some people see a need for the telehealth expansion, virtual appointments that can reduce the need for travel for certain types of care, or community support networks. These are faith communities, neighborhood groups, and local volunteers who often help seniors reach their medical appointments. Recognizing transportation as a critical component of healthcare access is an important step towards reducing inequity. Now, as always, there are certain myths that exist, and there are myths that exist around the elderly and transportation. And I'm going to take on 3 of these myths and debunk them. The first one is seniors need rides, family members should provide transportation. The truth is, many seniors live alone and have family members who live far away. The second, public transportation solves the problem. No. Many communities, especially rural areas, have limited or no public transportation. Myth 3. Missed appointments means the patient is non-compliant. The truth is, sometimes the patient simply has no way to get there. And I always want to emphasize that we cannot label a patient as non-compliant without really asking the patient what is happening, what prevents them from making their appointments or even getting prescriptions, because sometimes just getting to the pharmacy is a challenge. Now, let's look at some of the questions that have been posed. Likewise, we have 3. The first one, why isn't transportation considered part of healthcare? Historically, transportation has been viewed as separate from healthcare services, even though it directly impacts the patient's outcome, the patient's ability to maintain a healthy lifestyle. The second question, are rural seniors more affected? Yes, rural communities often face longer travel distances and fewer transportation options. Third question, What can caregivers do? Well, caregivers can ask healthcare providers about telehealth options, local transportation services, or community assistance programs. Now, I want you to understand that transportation might seem like a small detail in healthcare access, but for millions of adults, it determines whether they receive care at all. When transportation barriers combine with ageism, they create a silent healthcare inequity affecting elderly populations across many communities. Healthcare systems must recognize that access to care includes the ability to reach that care. But dignity, respect, and healthcare access should never be limited by age. Please, please support the aging who have paved a way for us to follow. I want to thank you so much for your continued support. Remember, like, share, subscribe. Get this information to your neighbor, to your friend. Not because it's not a discussion you have with a friend doesn't mean that the information would not be valuable. So share it. And please leave your comment, be respectful in the community section, and we'll talk. And until our next video, where I discuss another public health concern topic, I want you to stay strong, stay motivated, stay encouraged, and have a wonderful rest of your day.